Hi, welcome to this short talk on asking questions without humiliation. It's part of our 5 Minutes in Supervision series. My name is Matthew Links and I'm the Discipline Lead for Medicine Placements at Bond University here on Ugamba country on the Gold Coast. Being asked questions is central to the way we're all taught medicine, and we can probably remember both important things we learned and the feeling of being humiliated by not knowing the answer. This experience has been supercharged by increasing awareness about bullying in medicine, its adverse effects and the need to prioritise learner well-being. The Americans call this practice of rapid-fire questioning pimping, a term which is in itself offensive and should be retired, but there's a vigorous debate about whether it's a good thing. A learner putting themselves forward to answer a question entails the possibility of revealing what you don't know in public, and this takes courage. Supervisors need to enable this by a practice that avoids humiliation. There are some supervisors who use questioning to accentuate power differentials as a power trip, and it's also easy for well-intentioned questions to be misinterpreted. Clearly, we need to do this well. When considering bullying, teaching by humiliation can reasonably be considered an unnecessary and unreasonable behaviour that creates a risk to health and safety of the learners and a culture which is a risk to patients. When you look at what supervision entails, you can see that asking questions potentially has positive or negative effects on all these aspects of supervision. Particularly questioning that's perceived as humiliating harms relationship and motivation and role models bullying. Arguably, it's not learner-centred and doesn't deliver good quality information about performance once the learner's emotions are getting in the way. As the person with power in the supervision relationship, supervisors bear responsibility for appropriate questioning, but students have responsibilities too. We're all judged on our performance, and learners need to be able to cope with the public way in which our performance is judged and use this as a motivating factor. Skillful questioning by supervisors will enhance this. Perceptions of humiliation are subjective, but as supervisors, we need to acknowledge that medical culture has normalised behaviour that's now recognised as bullying, and we need to be part of improving that culture. The key to addressing this issue as a supervisor is to be aware of the issue and to be intentional about doing what we can avoid to humiliating learners. And it starts with that positive, supportive relationship that can be strengthened by thanking learners for stepping forward, acknowledging bravery, framing the process of questioning as intended to drive improvement is also helpful. Normalising not knowing and role modelling your own humility about what you don't know sets a really powerful example. And if you are aware that an identified learning gap might be considered humiliating, then take some steps to repair early. Being learner-centred in this context means understanding where the learner's at and working upwards from what they know, connecting existing knowledge rather than jumping to reveal what they don't know. And remember, the tone and approach you should model shows care and not power. And using a public question structure can help. There are published methods for clinical questioning, and one is the 1 minute preceptor. It consists of 6 micro skills. 1, get a commitment, e.g. for a diagnosis or a management plan. 2, probe for supporting evidence. What was the clinical reasoning that got them there? 3, teach general rules. 4, reinforce what was done right. 5, correct mistakes. And 6, identify the next steps for learning. So this has been a very short guide to asking clinical questions without humiliation. And here are some helpful references. I would encourage you to think about how you might improve your clinical questioning. Do your learners feel humiliated by your questioning style? We'd appreciate any feedback on this and good luck on your skillful clinical questioning.